A stroke can be caused by a plaque in the carotid artery breaking off, causing the blood supply to the brain to be cut off. Dr. Chris Marrocco, a vascular surgery specialist at Pomona Valley Hospital Medical Center, reveals that carotid arteries can develop serious blockages.
The carotid arteries are the two main arteries in your neck. They bring about 80% of the blood flow to your brain. They divide in sort of the mid-neck into external carotid arteries and internal carotid arteries. The internal carotid arteries are the ones that go to your brain. The external go to your face, less important. And then there's two vertebral arteries in the back. They come together at the circle of Willis and supply the remaining part of your brain.
Diagnosis of carotid artery disease leads to the type of treatment.
People can develop carotid artery disease, which is plaque and buildup of debris within the carotid arteries over time, and this can lead to strokes, and it's a very easy part of the exam to look at, to get an ultrasound of the neck and look at the carotid arteries. So it's part of any stroke workup, and it's part of any syncopal workup. We usually don't treat the carotid arteries until they're more than sort of 70 to 80% stenotic in asymptomatic people. In symptomatic people, we treat them sort of at any point if we can identify the lesion. And these are generally treated open, although we can do carotid stents as well. If they're 60% blocked in an asymptomatic person, we would tend to watch that. Get serial ultrasounds, put them on medical therapy, which includes an antiplatelet like an aspirin or a Plavix, and then a statin to stabilize the plaques. And then we continue to watch it over time. When it gets to that 70 to 80% range, that's when we would start considering fixing it, as long as they continue to remain asymptomatic. Asymptomatic is without symptoms. In the 70% range to the 80% range, that's where we consider fixing the carotid artery, and we fix it by opening up the carotid artery, removing the plaque, and then sewing on a patch. We do it with a shunt, which is like a little straw that keeps blood flow to the brain while we're doing it. There still is a risk of causing a stroke while we do this. We try to minimize that risk as much as possible. There are carotid stents, which is other things that we do, as well as a newer thing called Silk Road, which either reverse the flow or we put a filter past the lesion. The issue is getting the filter past the lesion can cause a stroke as well. So it's not that any of these things are technically extremely difficult, it's that the brain itself is a very unforgiving organ. Carotid endarterectomy is the gold standard. I mean, it's a very successful operation in general. I mean, low stroke rates, less than, I think, 1 to 2% for asymptomatic. For symptomatic, they accept a higher stroke rate of 3. And the newer paradigm is to sort of push towards doing carotid endarterectomies earlier and accepting a little bit higher stroke rate in doing them earlier, instead of waiting and having the potential for another stroke to happen while you're waiting for the brain to heal.
There are prevention strategies to prevent carotid artery disease.
So prevention of carotid artery disease is prevention of vascular disease in general, because the disease is not localized to one part of the body. This is just where it's showing up. So you would do things like a heart-healthy diet, exercise, that type of stuff.